Hi, this is Marie Ridgway with Marie Ridgway and Associates, and I'm going to be chatting with you today about healthy law enforcement families. This is a kind of an introduction for you both to mental health for law enforcement and also the family dynamic that often goes along with the stress of the job that you have. So at my practice, we are mental health care providers and we work with your agency. And you or some of your colleagues have access to us, or it's possible that we oversee a peer support team at your agency. We are master's level clinicians, and at our practice, we specialize in working with first responders. So we have all kinds of experience outside of work. I'm the owner and the lead clinician, and previously I worked in child protection and on the psychiatric crisis team, and I've been in the field for over 16 years. So my practice, I opened it in 2017, and we now work with over 45 public safety agencies in Minnesota. I was a training specialist with the Minnesota Chiefs of Police Association, and then started working with Blaine Police, and they're kind of our model wellness program. We've been developing our program along with many of the agencies we work with, but it really started with Blaine. That's where our program originated. Our programming for law enforcement has the acronym POWER program, Police Officer Wellness by Enhancing Resiliency. And so our program really is a foundational piece of it is that we know you are all very mentally strong and resilient, and naturally those stress can take a toll. The chronic nature of stress, the way that it tends to stack up in your work over the years is really what we try to assist with. So the work that we do in our practice really is just about helping folks with that stress response, whether you're having stress symptoms or an actual stress injury. And it's often following, like I said, many kind of stacked up events that you've had to experience. So we provide post-training, lots of different trainings on officer wellness, crisis intervention, peer support, team training, and then I train other therapists in how to work with law enforcement as well. So I would just love if all law enforcement officers in Minnesota are connected to therapists who knows how to help. And so it can't be always us. We can't do all the work. And so I'm always looking for really great therapists who want to work in this area. And then I teach them what I've learned over the last 5 years. So that's kind of big picture what we're doing. We have, we also provide clinical consultation for about 6 or 7 crisis negotiation teams in Minnesota, and many more than that peer support teams. This is these are the clinicians at our practice. So I'm the one there in the middle on the chair, and then we've got Katie, Nicole, Jerry, and Carly. And if your agency has a contract with us, maybe with mandatory check-ins or access to therapy sessions, these are the therapists that you have to choose from. We also have 2 therapy dogs. They're both purebred German Shepherds, and they are AKC Canine Good Citizen therapy dogs. So they've both been through lots and lots and lots of training, and also we're just born with the temperament of a service dog, and so they are pretty neat tools that we have that we use in our practice, both at the offices and when we come on site. They are half siblings. They have the same dad. Callie's the big sister. She's 3, and Charlie is 2. So I want to talk with you about how police work really affects the whole family, and then also how police work affects the individual officer as well, and the way that there are some ripple effects from the stress of the job. So it's been obviously a rough couple of years lately. And so, you know, it's been especially hard with COVID and social unrest and really lots of unknowns, more so than usual. We really like to know what to expect, what the outcomes are going to be, how long things are going to last, and we just haven't had those reassurances in the last couple of years here. So One thing that is particularly off and stressful is this feeling of a lack of control. Very understandably and naturally, we like to feel in control or some sense of control. And it can cause feelings of insecurity, worry, anxiety, and that goes, of course, for officers and for their families. So if there's just everything out there, the idea is, what can we truly control? It's really a very small portion of everything that goes on. And what it boils down to that we can control is our thoughts, our attitude, our actions, and our effort. And so that's it, really just ourselves, and those 4 things within ourselves are what we can control. And so really dialing into that and focusing for yourself on what you can control is going to be one of the healthiest things you can do. And one of the healthiest things your significant other, your family members, what they can do, having understanding and knowledge about what your work is like, what it's about, and what to expect. And then also the 2 of you having a team approach and really dialing into taking care of yourselves and each other, because law enforcement is really, you just like a military family are a law enforcement family. So here are those 4 things that you can control. You can choose your thoughts, like you pick clothes out each morning. You can choose your attitude or your mindset. Really, this is your foundation for everything else that you choose to do. Your effort is what you choose to put your energy and resources and time towards, and then the actions you take. So if the things that you think and what you say and what you do line up, that's your integrity. And these are the things that you have control over. So, I'll review for you some of the most important factors for staying resilient. And then it'll be your attitude and mindset toward those things and towards what goes on around you that you can't control, that's going to help keep you strong. These are those 6 factors. So your sleep and your non-sleep deep rest. This is your most important one. Sleep and your recovery for your brain are the most important ways to manage stress. So while you're sleeping, your brain is essentially repairing itself from the day prior and then preparing itself for the next wake cycle. So your REM cycles are one of the most important parts of your sleep. REM sleep is rapid eye movement sleep, and it's really when your brain is sorting through and filing away things that it needs to take care of. There's another part of your sleep called deep sleep. That's when your muscles and the other cells in your body, your organs, your tissue, all of that is doing repair work. And so without sleep, you will over time find plenty of strains on your body. Really nothing about your mind and body can function properly without enough sleep. And so making habits that really prioritize your sleep is going to be extremely important. Everybody needs between 7 and 9 hours of sleep each night, and anything less than 6.5 is really greatly going to reduce your capacity for your immune system to function properly, your memory, your even your reaction time, all different kinds of things. So it's really important to make sure that you're prioritizing that. And then your non-sleep deep rest. This is the moments you may have while you're conscious and awake, where you're not sleeping, but you're resting. So whether you use some breathing techniques, tactical breathing, whether you use mindfulness, you may find certain movement or exercise to be very kind of relaxing and rejuvenating for your brain. Really, it's when your mind isn't having to think about the past or the future that it's able to recover and rest. And so your non-sleep deep rest is really very important along with your actual sleep. Your exercise is a close second. So exercise and movement, if you have to choose between the 2, your sleep is more important, but also extremely important is your exercise. So it's in your line of work, you have plenty of stress, you're highly trained in how to operate under stress and pressure, but you also really need to train yourself to recover and rest. And exercise is one way to build in sort of a way to bridge yourself from that intensity and stress of the job to your downtime, your home life, your personal time, and that whole different operating mode. So when you are regularly exercising, you're going to be clearing out stress chemicals. You're going to be also bringing into your brain feel-good chemicals like endorphins. And so to have regular exercise and to use exercise intentionally to de-stress is going to be a really important factor for you. So if you aren't already doing something regularly, definitely add it in. Many agencies are allowing workout on duty when that's possible. It's a great way to combat stress and have your work be sustainable. Support. This is about feeling supported at work and also feeling connected at home. So we have other trainings on this. Specifically, we have a law enforcement couples presentation and training, an online one available, and we do it at different agencies because it's so important. And so that's part of why we're talking about this today, this healthy family presentation, because it's important that all of you and your loved ones are on the same page about really what the job requires. Your loved ones may also have stressful jobs, and so if the two of you can build in good understanding about what's needed for you individually to be healthy and for you to be healthy as a couple, you're going to have the best success. So the next factor here is of having a balanced life. So this would mean making sure that outside of work you have plenty to do that you enjoy, your hobbies, your activities, your connectedness with your family. What do you do for fun in your personal time? A really healthy law enforcement officer has a good balance of work, but not too much work, and certainly an ability to set things down and really switch into that different gear or operating mode that you're in your personal life and take it in, whether it's travel or different events or things you do as a family or individually that really kind of refuel your tank. That's going to be good for you. And to keep doing those things. Don't let those things be just things that you used to do. Continue to have them be things that you do and that you practice being able to be fully immersed in. So one of the pitfalls in law enforcement is when you feel really effective and good and satisfied and purposeful at work, and you maybe bring home that same operating mode and don't feel so successful at home. Home life with family and young children can be kind of chaotic, and it can feel a little out of control, and you might feel like you fit in better at work and you just want to work more. You may build a life that depends on overtime or something like that. And the risk you run is that you can eventually become very unbalanced and therefore less happy. So really your family life helps you keep a balance, helps you keep a good perspective, and your ability to switch between these operating modes of work mode, which is really far on a spectrum in one way, and then over to the other end of that spectrum, the home life is going to be one of your most important things you can do here over time as far as a balanced life goes and your mindset. We talked about mindset, optimism, having a strong grasp on what you can and can't control, your attitude towards things. All of those things are really good for you. And then the last one is professional care. So your access to professional care is part of your resilience, and then your willingness to utilize it. So whether your agency has mandatory check-ins or you just choose to head in and chat with someone who specializes in your line of work and the stressors and what's necessary to be a high performer in your area and to have a fulfilled, satisfying life, your willingness to do that is really important. So if you can choose for yourself to drop any stigma towards mental health care, really think about it as brain health and having a desire to take care of your brain the same way that you would want to take care of any other organ of your body is going to be key. So those are the things that make up your your resilience. Those are the 6 factors that it comes down to. And I want to just give you a little bit of a quick example of how this plays out in the real world. So there's a book by Robert Sapolsky called Why Zebras Don't Get Ulcers. And it's becoming a little more well-known. I talk about it a lot when I present, but it's interesting. I want to point out just a couple points he makes. He talks about why is it that zebras, when they are also mammals as we are, why don't they get ulcers? They don't get PTSD, they don't get heart disease from stress, but they also have stressors like predators. They can, they can have life or death scenarios that put strain on their systems. So really the only thing a zebra has to worry about is starvation, injury, and predators. And so interestingly, while they're stressed, if they're being chased by a lion, they are exercising, right? It's built into the actual experience of stress is exercise in that case. And so that is really important thing to keep in mind, because once they, outrun the lion and they live to talk about it, they then will, do a full body shake, clear out the rest of those stress chemicals. They'll drink in a bunch of water to rehydrate, and then they'll probably take a nap in the shade, right? And so some things that they're not doing in between those stressors are worrying about things that people worry about. Humans have to worry about other things, finances, relationships, deadlines, but in law enforcement, then you also have these constant daily safety and survival related worries on top of that. And so if in between your work shifts and your rotations, you're also stuck in kind of a hypervigilant mode, that would be why there are higher rates of ulcers, PTSD, heart disease, all of these things, weakened immune system, all of these things that come from chronic stress. So as humans, we are not built for ongoing stress. We are really just built for things that temporarily knock our system out of balance. Stress is that disruption of homeostasis, it's being knocked out of balance, and then your stress response is what returns you to balance. So you need to spend a lot of your time feeling balanced and not stressed, really all of your time away from work. And then when you are at work and you need to be hypervigilant to be safe, let that be the time that you let your body feel that stress and perform under stress in the way you've been trained, but then again, be able to switch back out of that mode and really decompress outside of work. So in law enforcement, you have plenty of exposures to potentially traumatic events. I've listed here many of them. And I want to just point out, though, that some of these will just sort of start to feel like they're all in a day's work. For the average civilian in a lifetime, they'll experience just a handful of these, maybe 2 to 4 in a lifetime. But you'll have exposure to these that many times, maybe in a day or a week or a month, depending on the area of the state that you work in. And so I want to make sure you keep in mind the stacking effect that these things can have. So your brain will store some of these experiences differently than others. If you remember anything with any kind of vividness, it's likely because you had an emotional reaction or stress response to what you had to see or do. And so keep that in mind, because that is what can start to sort of fill your container. And so the things to watch for especially are if there's a certain kind of call that tends to bother you more than others, that's normal and it's something to keep an eye on. And then the other thing is if you can relate to any aspect of a certain type of scenario that you're having to deal with, that's going to make you more vulnerable to having a stress reaction, because you can't any longer have that healthy level of detachment if there's any aspect of relatability. So it isn't ever just one single acutely stressful event that sort of puts someone over the top for how much stress they can manage. It's really the stack of stressors that builds up over time that you need to keep an eye on. And then also sometimes it's one, because your capacity has been reduced by that stack. Sometimes there's one that really will feel like it puts you sort of over the edge. So how frequently you're encountering these events and how closely they're happening together, how high they're stacking up is what to keep an eye on, and to certainly reach out before that container starts to fill up. So the things that often you'll experience will just kind of pass through you. If you acknowledge how things felt during your day, if you get a good night of sleep, if you're exercising, if you're staying hydrated and eating healthy, if you have solid feelings of support, a strong mindset, a balanced life, a lot of what you experience is just going to kind of pass through you, and that's normal. But what doesn't is going to sit with you, kind of like you have this container for stress. And really, it's your body that's the container for stress. And so stress can start to stack up. And as it does, it essentially leaves you with less capacity for what's ahead. You really want this window of stress tolerance to be as big as it can be, because you know there's more stress ahead and you just don't know how big of a stressor you're going to be faced with at work. Not to mention, you're all humans, you have personal lives, you may have major losses, you may have childhood abuse or neglect or experiences that have stacked up, been part of what has stacked up in that container. And so really keep an eye on this. Even check in with yourself every few weeks or months as to what's in there and how high it's stacked up and what your capacity is for what's ahead. So keeping that level low is going to be really important. The reason is because we're really built for stress. We're built for mild and moderate amounts of it, and you're all very well equipped for it overall. But if you ever have a feeling of guilt about something that happened, the thoughts of I should have, woulda, coulda kind of thing, that often indicates that you're having a response that's more than just a brief temporary stress response. That means that you may have experienced a feeling of helplessness, which is sometimes indicated by a feeling of guilt. And then the other one is abandonment. So if someone who really should have been there for you wasn't, that can potentially cause an experience to feel traumatic versus just stressful. So ultimately, trauma is when the demands on your system exceed the available resources. If you haven't been sleeping well, if you're overusing alcohol, if you don't have good connectedness and support, if you don't exercise, and your mindset has taken a toll maybe from work, from stress from work over the years, you're not going to be as well equipped. You won't have as much, as many available resources essentially to give when a scenario comes up that might demand more from you than you have to give. That's really what trauma is. So what we really hope to do is to help people recognize their subclinical symptoms and to stay as low on this spectrum as possible. Normal to move around on it a bit, but it gets to be really worrisome anytime somebody gets to be in that moderate or severe range. And so please keep an eye on any stress symptoms you have, especially sleep. How is your sleep affected after certain things you're experiencing? Keep an eye on your alcohol use and keep an eye on the thoughts that you're having. If they're starting to turn negative about yourself or others, any of those things can be signs of a stress response. And so, think of them as at first they are really subclinical symptoms, and you want to keep them as that and not let them get out of hand. Your loved ones are usually going to notice first for you. If you're stressed, you may not notice it yourself first. So really trust them and let them tell you if they're noticing something. If you are seeming more anxious, more distant, more irritable, if your memory is not what it usually is, if you're having physical tension or pain, nightmares, inability to fall asleep or stay asleep, low energy, any of these things are certainly things to keep an eye on. And there are more stress symptoms than what I've listed here, but this is just a few of the most common ones. So back to this idea of emotional agility, I mentioned you have your street mode, your operating mode at work, and then on the other end of that spectrum is your home life. And so this is something that you really need to to protect that operating mode at home, you need to allow yourself to have your guard down, be emotionally tuned in, more vulnerable and flexible, able to just kind of roll with it. And then, most officers don't have trouble sort of dialing up to that street mode where you need to be hyper vigilant, you need to be ready for anything, one step ahead, able to control a situation, but then really be able to dial back and switch into a very different mode at home. Because if you misapply any of these operating modes, you feel consequences. So it's really understandable that that street mode gets reinforced for safety reasons. Your brain will, just for efficiency, try to stay in that mode, even if you're not at work, so that you're ready for it the next time you need to be in it. But you're going to have to really consciously and intentionally do things that help you switch out of it to protect this range, this emotional range that you need to have in order to be healthy all around. These are some of the challenges for your family. If you work in law enforcement, there are also unique challenges for families who have two, who both people in the partnership are in law enforcement. But these are just a few of the things. Keep in mind your family. You're choosing this career, your family didn't, but there certainly is an effect on them. And so because of your choice, they have certainly their challenges to contend with. So just keep these in mind. They're very common to have come up, and allow the two of you to influence each other, to listen and to the feedback about each other, and to give each other the benefit of the doubt. And really to keep an eye on that stress response and have ways that the two of you connect really regularly in positive ways. This is a great book. If you don't already have it, it's called I Love a Cop by Dr. Ellen Kirschman. It's been around for a while. She has worked with law enforcement most of her career and is a really well-known therapist for police. And so this is what families need to know. This book contains a lot of information, really good information. It is thick, but it's a good one. So I would recommend it for your family to have as a resource. All right, so I want to make sure you all know about your access to therapy. You've got a couple of options. There's talk therapy, and you may want to just check in, see how you're doing, just like you would with a checkup with your primary care physician every year. Or you might want to talk through an experience you've had that hit you as stressful, or you want to problem solve something. You may want to come in as a couple and talk. Or you also have the option of eye movement therapy. At my practice, we are all trained in ART, accelerated resolution therapy. And so this helps really file away those memories that have been saved, not filed away correctly. They've been saved and tied to an emotional response, which causes them to be vivid and sometimes distressing. It may be images you wish you didn't have in mind, or they come to mind when you don't want them to, or they get queued up by reminders. And so those maybe at first aren't too bothersome, but over time they can certainly add up, and some may be worse than others. So it's very effective and efficient method for processing stressful experiences. And it's used in the military, it's used widely in law enforcement. We've done hundreds and hundreds of sessions for law enforcement officers in Minnesota with ART and have seen really good results. So I wanted to make sure you know about that as an option. And then please, if your agency contracts with us, that's why you're watching this video. And so we look forward to getting to meet you and work with you. Please take down our contact information. You're welcome to just put it into your phone as a contact. This is our main number. We are always available 24/7. This number goes right to our phones. And if we're not immediately available, there'll be an alternate on-call number you can reach if you have something urgent. We do have a 1-hour callback time, but otherwise feel free to reach out by email. Information@marieridgway.com is a great option. And then you can see our website as well, marieridgway.com. There's lots of resources on there. Your agency works with us, which means you have access to our program participant page, The password for that page is Charlie. That's the name of one of our therapy dogs. And so you're welcome to look in there too. There's lots of resources about the resilience factors and about stress and all different kinds of topics. So please check that out. Please reach out if you ever do need anything. We are so happy to help. It's an honor and a privilege to be able to work with you and with your agency. And so we hope to get to chat in the near future. Please take care and stay safe.